Hi guys, let's see about retinopathy of prematurity. It is a bilateral proliferative retinopathy occurring in premature infant less than 32 weeks of gestation with low birth weight of less than 1500 gram. Normally, the retinal blood vessel reaches from the optic disc, it reaches the nasal periphery by 8 months of gestation, and temporally it reaches 1 month after the birth of the infant. So here we have a premature infant. Some postnatal factors like increased oxygenation or sepsis or transfusion or acidosis or some nutritional deficiency will affect the retinal vessel growth. This will be followed by a pathological proliferation of the retinal vessels causing retinopathy of prematurity. Usually it will be mild. Sometimes it can cause retinal detachment and blindness also. So we have 5 stages for this. First stage is the demarcation line formation dividing the vascular zone from the avascular zone. Stage 2 is demarcation ridge where the demarcation line lengthens and the breadth increases. Stage 3 we have extraretinal fibrovascular proliferation into the vitreous. 4A is subtotal detachment which is not involving the macula. 4B is subtotal detachment involving the macula, and stage 5 is total retinal detachment. So we have a funnel shape here. Zones of retinopathy of prematurity, we have 3 zones. Here the center is kept as a optic disc, and zone 1 is a circle drawn center of optic disc and twice the distance from the optic disc to the macula as the radius. This is zone 1. Zone 2, circle drawn from the center of the optic disc to the nasal ora serrata as the radius. So the distance between the zone 1 and this zone is called as zone 2. Zone 3 is the temporal crescent of the retina beyond zone 2. And we have plus disease. Plus disease is venous dilatation and tortuosity in more than 2 quadrants of the retina. So the treatment is screening. We should screen the premature infants 3 to 4 weeks after birth or 32 weeks of the age for any changes. Laser photocoagulation by diode laser or Nd:YAG laser is the treatment of choice. If there is a disease in the zone 1 and there is a plus disease, stage is not at all a criteria. Any stage we have to do laser photocoagulation. In zone 2 disease, which is not having any plus 2 changes, but it is stage 3, then we have to do laser photocoagulation. For zone 2, if there is a plus 2 disease and the stages 2 or 3, we go for photocoagulation. In advanced stages, we have to repair the retinal detachment also. Other treatment modalities are anti-VEGF therapy and pars plana vitrectomy. Thank you.